President Trump's one big beautiful bill was introduced with bold promises: economic relief, less red tape, and a boost for everyday Americans. But the bill also included nearly $1 trillion in Medicaid cuts that could have devastating consequences for millions of people with disabilities, especially here in Texas. For families already navigating an underfunded and overburdened Medicaid system, the new eligibility checks, work requirements, and biannual redeterminations baked into the bill could prevent people from getting adequate access to health care. Texas, which ranks near the bottom nationally in healthcare access and services for people with disabilities, stands to be hit especially hard. Rural communities where hospitals rely heavily on Medicaid funding may soon face clinic closures, staffing shortages, and deeper gaps in care. Is all that accurate? Well, we're going to find out. Helping us break it all down is Jeff Miller, Healthcare Policy Specialist for Disability Rights Texas. Jeff, welcome to the show.
Thank you for having me.
A lot to set up there for people to understand. I just want to also jump in and say, if you would like to join the conversation, ask questions of Jeff, or get a better understanding of some of this, give us a call or text at 713-440-8870. I guess the place to start is, we heard a lot when the big, beautiful bill was being put forward that it would not affect health care. It was not going to harm our health care. The reality on the ground, from what you've seen, what's gone through, what we expect to happen is what?
Then it's a whole lot more complicated than it's just not going to impact your health care. If it's okay, just real quick, I would like to start by just saying, when you look at healthcare in the country and the healthcare provisions in the reconciliation bill that was passed in July, there's really three different programs you're looking at. You're looking at Medicaid, which is the state and federal partnership that states partner with the federal government to provide services mainly for pregnant women, children, and people with disabilities. Then you've got Medicare, which I think most of us are familiar with because it's the program that protects people when they are retiring or older. And then there's some other cases where it gets involved, but mainly. And then you have the ACA, or private insurance, that people can get subsidies, some people, from the federal government to purchase their care through a marketplace.
Right.
And so if you impact any one of those programs, you're going to end up with some people losing coverage potentially and some disruption in the healthcare system. If you impact all three of them, we're not sure what's going to happen. We just know that there's potential for lots of things that aren't necessarily what we'd like to see happen. One thing to remember about Medicaid and people with disabilities is that most insurance policies, including Medicare, only provide medical care for people that have a broken arm, a broken foot, need to go to the doctor's office, need a hospital stay, need an x-ray. Those are the things that the medical kind of benefits, or we sometimes refer to them as acute care benefits, that things like Medicaid or Medicare and ACA policies provide. Medicaid provides some of those services as well, but the reason that Medicaid is so important to so many people with disabilities is that Medicaid also provides what we call long-term services and supports. These are benefits that allow an individual, instead of getting care in, say, a nursing facility or an intermediate care facility for people with intellectual and developmental disabilities, people can get services in their own homes or community homes in their communities and don't have to be institutionalized in order to get the support needs that they need.
Let me jump in here and ask you a quick question about that. If those services are cut, those services are reduced, then I would assume it rolls downhill. Then the impact ends up increasing on Medicare and then also on private insurance. Because you can't just ignore the issue.
Absolutely.
Okay.
And to exacerbate all of this, you have to look at it through the lens of what's it like in Texas before the reconciliation bill was passed.
Okay.
Remember, in Texas, Medicaid provides these long-term services and supports to individuals in their communities if they have functional need and economically qualify. What Medicaid says is that states, there are certain kinds of benefits you have to provide, like institutional care, like a nursing facility. And then there's permissible things that you can provide if you want to, as long as you stay within a financial guideline. And so for those community-based services, if I need to go to a nursing facility and I meet the qualifications the state is playing in Medicaid, they've got to provide that nursing facility care for me. If I'm somebody with a disability that wants to live in the community, the state can say, well, we'll get to you as soon as we can, but right now we're only going to fund X number of slots for these Medicaid waiver services. Right now, we have about 180,000 people waiting for services in Texas. The fear is that if you take money out of the Medicaid system, along with drawing money from the other two systems as well, you're going to end up with many more people looking for services. And since the state can't cut things like intermediate care facilities for people that have intellectual disabilities or nursing facilities, we are really afraid that we'll see fewer community-based services provided if those resources have to be moved from the community to institutional-based care, because that's what the law requires.
So, Jeff, correct me if I'm wrong. What I also understand is that the eligibility requirements and the paperwork to basically file for eligibility is going to become much harder and the process will be longer.
That is exactly what it appears. And this is all still just happening. So
Right.
we're going to find out over the next couple of years as some of these things get implemented. But eligibility for Medicaid in Texas has been challenging for the last several years. There's been lots of problems with the whole redetermination that happened after the COVID stuff
Right.
and all of those things. So we're just recovering from that. And so potentially what the reconciliation bill does is it takes a lot of the paperwork kind of things that were in place and planned to go into place to give more flexibility to states when it looked at looking at eligibility and processes that had to be done and ways of trying to determine someone's eligibility without making them send in paperwork over and over again and pay stubs and all those things. All of those things that were in place, they were placed on hold. Now, the majority of the changes in actual programs in the reconciliation bill and Medicaid are happening to states that expanded Medicaid, which Texas didn't do. So technically, a lot of those processes, the checking twice a year instead of once a year, of requiring work requirements and all those sorts of things, we don't have to do in Texas because we didn't expand Medicaid. But that doesn't mean that we won't see the programs that we do have be impacted. Because like I said before, if you take $1 trillion out of a program, and it's a very lean program to begin with, because in Texas, that's just the way it's always been. Something's got to give somewhere, and that's our biggest concern.
Right. And we are speaking with Jeff Miller, Healthcare Policy Specialist for Disability Rights Texas. If you would like to join the conversation, you can call or text 713-440-8870.
And Jacob from Montrose does want to join the conversation. Jacob, what's on your mind?
I have a part-time job and I have disabilities. How does this big, beautiful bill affect me?
Thank you very much for that, Jacob. Let's find out. Part-time job with disabilities. How will this impact his world?
It depends on what benefits you receive based on that disability. Are you receiving Medicaid because of that disability, or are you receiving Medicare? And so that's going to be the biggest question, is determining which program you're on, and then that would determine whether or not there's going to be a direct impact or potential future impact. One of the things, if I'm allowed to give a slight plug here, Disability Rights Texas is the state's protection and advocacy agency for folks with disabilities, which means that we get some federal funding to help individuals that have disabilities in the state either connect to services, deal with some kind of potential discrimination, or try to figure out how to get the supports they need in the way that they need them. Mm-hmm. Disability Rights Texas is a statewide program. We have offices around the state, and we don't normally charge for our services. So if someone is having an issue with a disability-related problem, and first of all, they don't know where to start, we do a lot of information and referral at Disability Rights Texas. Mm-hmm. Or they think they need someone to help them, an advocate or an attorney to help them get the services that they need, they can call Disability Rights Texas. And if we can't take the case ourselves, we are really pretty good at providing some resources to people and giving them information about other agencies that might be able to meet their needs.
Let me ask you quickly, when all this was going on up at the national level, a lot of talk was focused on, this is to end fraud and abuse that's happening in the system. And the other side of it was the states will pick up the slack of what the federal government takes away. Any truth in any of that? Can a state like Texas pick up what the federal government would take away?
Well, there's nothing that would prohibit Texas from expanding programs in Medicaid. Mm-hmm. But historically, we haven't done that.
Do we have the money to do that?
Well, I think you have the money that you decide that you want to find, right? Okay. We spend lots of money on lots of things. We went out of a regular session with several billion dollars in surplus that we didn't spend over the last legislative session. So if Texas were to decide this is what's best for Texas, I think that money could be found. It's just at this point, that hasn't been a big part of the conversation.
And Jeff, speaking of this, we look at propositions. Is this something that could be brought for Texans to vote on, essentially, if we are seeing major cuts?
Absolutely. I mean, it's like anything else that's in state government. Medicaid is funded through the state budget, and there could be proposals during the next special legislative session, if we have one, or the next regular session, to actually increase more money for these Medicaid programs to keep people in their communities, which in the past, our record of funding those programs has varied from in the early teens with a lot of new, what they're called Medicaid waivers. Sure. That's how they're referred to. So we saw a big increase in the number of those waiver slots that were funded. The last couple of biennia, not so much. So it's just a matter of families getting involved and advocates continuing to work with the policymakers that are interested in these areas and letting them know what the need really is in the state. And
Jeff, one last time, where can people find information about Disability Rights Texas?
Well, our main phone number is 512-454-4816, or you can go to drtx.org. And we have a website that has all this information. And like I said, we do casework for people that need actual help, but we also do a lot of information and referral. We do a lot of training for individuals and families to understand their rights and know what their rights are. So check out our website. There may be something that can help you.
Jeff Miller is the Healthcare Policy Specialist for Disability Rights Texas. Jeff, thank you so much for joining us today on Hello Houston.
Well, thanks for having me.
Thank you.